Good afternoon, everybody. My name is Jackie Kameri and I'm from Kenya. About 4 years ago, in May of 2012, I went undiagnosed with, this is hard to say, I'm sorry. I have a brain disorder, and it was undiagnosed for 37 years. And so I found myself at a psychiatric hospital and was later transferred to the state mental hospital in shackles. So my wrists were in shackles and so were my feet. And the system is designed to break you down. It's not designed to uplift you. And so when I came out of the hospital, it was really hard for me to understand what was going on. I had no idea what mental illness was. And nobody in my family could understand what was going on either. So I was having a really hard time with my doctors because I didn't know what ADD was. I didn't know what bipolar was. I didn't know what schizophrenia was. And so when they're asking me all these questions, I had no idea what they were talking about, but it's something that I've been living with my entire life. So that was the beginning of my journey. So it happened again the next year, and I was back in this psychiatric hospital because I ran away from my doctors. I couldn't understand the psychologist and the social worker and the case manager. It was like 8 different doctors. It was too much for me, so I ran away from them, and I was back in the hospital the next year. So my vision was formed during the process that I was going through all that. So Baraka Village is my own foundation. It's my own startup. So we're a natural hub and a melting pot of human and information resources. Our purpose is to foster niche multicultural partnerships dedicated to create awareness of mental illness and end the stigma and stereotypes associated with it. We aim to create awareness of mental health amongst the diverse and underserved African ethnicity communities. That is Africans in the motherland, in the diaspora, African Americans, Afro-Caribbean, and Afro-Latino communities. So I am the founder of Baraka Village International. I'm also NAMI, which is National Alliance on Mental Illness, Kansas State board member. I'm also a NAMI Johnson County board member. And I'm also a representative at the state level on the Consumer Council, which advocates for rights of people with mental illness, such as myself. There's too much incarceration, too many shootings, too many hospitalizations, and too much medication. So we fight for all those rights. I'm also a board member at Pathway to Hope, which is where I began my journey from. So the challenges that we face in the African community is, number one, lack of accurate information for the different ethnicity groups. We're all classified as African Americans, and we're not. There's a huge, huge cultural difference. And there's also lack of adequate resources, being human and financial in African medical terminologies. I had to do all my research on Facebook because I couldn't find any documentation. I couldn't find any resources. I couldn't find anything. Nobody wanted to talk to me about it because they didn't really know what was going on about it either. So lack of minority role models is a big problem for me because we have a lot of celebrities with mental illness, but they don't come forward to help us out in the community. Same thing goes with cancer and terminal illnesses. There's inadequate use of technology to bridge all these gaps. So it's a huge problem. Our advocacy and outreach efforts are combined result of networking and collaborations formed with different organizations to create awareness of mental health and provide educational, informational, human resources to the communities we serve and partner with by establishing a solid and pioneered footprint. Brain disease, brain disorders such as mine, and brain injuries are classified under cancer My diagnosis is bipolar disorder with psychosis, which is pretty much borderline schizophrenia, and I do exhibit schizophrenic symptoms during my illness. So this is some of the work that I've done with the African diasporan community. I was the first caller on the first ever radio talk show, which is a one-mic show. I'm a keynote speaker during National Minority Mental Health Month at the first African Taste of African Festival. I was the first ever mental African survivor to advocate, featured in We Thrive publication, which is an African publication. And I was the first ever guest speaker at Queensland Ministry International. I've done a lot of other advocacy work in the community. I'll just highlight that my next speaking engagement is going to be at Cerner Healthcare. Cerner is one of the largest healthcare and ICT companies in the United States. And I'm also doing a collaboration with Nasi Wangu in Swahili, so we can talk about mental illness in our own communities, in our own languages. So the outreach that we use is media, which is social media, publications, audio podcasts, YouTube, films, TV. We're out at events, festivals, sporting shows, nightlife. I'm everywhere. I do workshops, I go to conferences, I do fundraisers, I go to corporate, I do panel discussions, schools, universities, churches. I go to the mosque. We're all interfaith. The projects that we're looking to get into are entrepreneurial and philanthropic. Collaborations that we're looking for is especially medical professionals from the African communities, such as doctors, psychiatrists, psychologists, therapists, counselors, nurses, professors, social workers, caregivers, etc. And also legal practitioners to help us bridge that gap with the judicial systems. Persons with disabilities and survivors and warriors such as myself, and also volunteers, spiritual leaders from the community. Okay. So this is what we're involved in. Thank you so much, and you can find the rest of it on our website. It's barakavillage.com.
And so you can hear